So menstrual cramps, period pains, periodic pains, whatever you want to call it, is one of the most common complaints in menstruating women. I mean girls, ladies, and women who haven't yet reached their menopause. And sometimes it can lead to stress. I know it because I go through it. Like not even like a day before, but a week to my period, I can be like, oh my god, the next 4 days, how am I going to handle it? Because the first day treats every woman, every girl who is menstruating like it's your first horrible day, and then the next ones they're okay. So I've reached at a stage where my periods come in peace and go in peace, but I know where it can. I know people who have had stress, who have had low self-esteem, and imagine you have to go through this every single month, and also those who are working. Imagine calling your boss and telling your boss like, I'm not going to come to work tomorrow. Why? Because I have pain. And they're like, really? Like you're faking it. But I know people who can't even get out of bed. I know people who have like bad experience with pain. So in today's video, we're going to address that. We're going to talk about period pain, and let's do it. My name is Tabiramu Samantha, a registered nurse, and on my channel I talk about everything health, nursing, blogs, and lifestyle. And if that's the content for you, feel free to subscribe so you don't miss out on any of the videos that I post. Today I'm going to be discussing what are periodic pains. I'm going to discuss about the different types of the periodic pain, their causes, how you can treat it at home, and if there are any medical conditions, how it is treated in the hospital. Painful periods scientifically are known as dysmenorrhea, and they are divided into two: primary dysmenorrhea and secondary dysmenorrhea. Primary dysmenorrhea, this is pain that occurs, however, all the pelvic organs are normal. There is no problem with the pelvic organs, and this pain normally comes before the periods. And some people normally get the lower abdominal pain, then some people get the back pain. I'm going to give you the signs that I get or the symptoms that I get when I'm in my periods. I normally get nausea, I vomit, I get diarrhea, I get dizzy. However, people normally have different things. Some people get constipation, whatever you have. I've seen even some people get hospitalized because of um, periodic pain. So I do not know which signs and symptoms to get, but people get sick. That's why I always advocate for menstrual leave, maybe a week when someone has gone into their periods. It seems like people take it like it's a normal thing for women to go through, but it's hard. Like people faint. I've seen people fainting because of pain. I've seen people getting real sick because of pain. Some people are admitted because of pain, and pain may go for 3 days, for one day, for two, depending on your cycle, on your experience. So that's all I can say. Women are generally become sick and they get different symptoms. Sometimes I would even get like pain in migraines. I'll get back pain, I'll get lower pain, I'll lose appetite. So whatever you get, everyone with their own symptoms. Why do we feel pain when all our pelvic organs are normal? There is a little friend of ours called the prostaglandin. Prostaglandin is a chemical released from the uterus during menstruation, and it is normally used to stimulate or contract the uterus during menstruation. So when the uterus is contracting, the blood vessels are normally narrowed. And remember that blood contains red blood cells that normally carry oxygen. And when the blood vessels are narrowed, less blood is going to reach the uterine muscles. Therefore, during contraction, less oxygen is going to reach the uterine muscles, causing pain. And this is the same explanation that is normally given in the cardiac pain. Lack of oxygen causes pain. There are also some other causes or factors that can cause primary dysmenorrhea. Number one is genetic factors. If you have anyone in your family, preferably your mother, had painful periods. My mom told us, me and my sister, like, you know what, I also used to go through this. So genetically, she passed it on to us. We also had the painful periods at the beginning. So if anyone in your family has painful periods, it's more likely that you also are going to experience painful periods. Early menarche, I mean people who have started their periods at the age of 9, at the age of 10, 11, 12 years and below that, you are at a high risk of primary dysmenorrhea. If you're a smoker and obesity, monitor your weight. There is nothing good about being obese. There is nothing. I haven't seen any good thing about being obese. So monitor your weight. So ladies that also have heavy periods, we also know that they normally have those clothes, those big clothes. I talked about it in one of my videos. You can go and check it out. Um, they normally have those clothes. So when the uterus is contracting, it has to expel those clothes, and it is extremely painful. I have gone through it. I know you feel like someone is pulling out your uterus, someone is pulling out things from your uterus. It's extremely painful, and you feel it. By the way, when it's coming out, you feel that the clot is out. You feel so much relieved. But also, this contributes to primary dysmenorrhea. And when you have those heavy periods, of course, they contribute to the clots. And when they're being expelled, you feel the pain. So we are done with primary dysmenorrhea. We go to secondary dysmenorrhea. Secondary dysmenorrhea is when there is an abnormality in one or some of your pelvic organs. Our pelvic organs, you know them, we have the ovaries, the fallopian tubes, and the uterus. Remember, we said in the primary dysmenorrhea that the pain is associated with the periods. However, in the secondary dysmenorrhea, the pain is not associated with the period. You'll notice changes, first of all, in your period, and then you also notice pain. Pain may become even before your periods, during, and even continues after your periods. And remember that this pain intensifies with the periods. And this is the time we should start thinking about visiting our gynecologist, going to the hospital. So some of the causes of secondary dysmenorrhea, my first one I can talk about is the PIDs, or the pelvic inflammatory diseases, and this normally results from untreated sexually transmitted diseases. Infection normally starts from the vagina, comes up to the pelvic organs. So if you're being treated for pelvic inflammatory diseases, or you've been diagnosed with it, make sure to complete your medicine so that you prevent dysmenorrhea in the future. So my next point or factor is endometriosis. It's a common condition in women and normally can affect any woman of any age. They said around 80% of women can get endometriosis. And this is when the lining of the uterus implants itself outside of the uterus. So the uterus is lined by the endometrium, and the endometrium is the one that normally sheds off during every menstruation. So when there is no fertilization of your egg, the endometrium is automatically going to do what? It's going to shed off. However, in the endometriosis, as we have mentioned, that the lining of the uterus implants itself outside of the uterus. So if it has implanted itself outside of the uterus, it is going to build up and it's going to be bleeding every single month. However, this blood is not going to have anywhere to go. So what is it going to do? It's going to bleed inside of the pelvis, and this is also extremely painful. So you will need to go to the hospital, you will need to see your gynecologist, you will need immediate medical care for this condition. So we go to the adenomyosis. It is not a very common condition. However, the lining of the uterus implants itself in the muscle wall of the uterus. So every month when you bleed, it bleeds into the uterine muscles. To me, I believe that nurses should be the first responders to women who come in complaining of period pains, because you should be able to differentiate between primary and secondary dysmenorrhea. Because if a lady comes in and she's over 25 years of age, she think of outside the box. Is it infertility? Does she have pelvic inflammatory disease? Are there blockage of the fallopian tubes? Like, what is the problem? Instead of just saying you go home and take ibuprofen, take paracetamol, maybe ask them, have you been on these medications, before dismissing someone's periodic pains. So if there is a family history of fibroids, if there is ovarian cysts, if there is polyps, watch out. Don't take the things politely, don't take them lightly. These are all causes of secondary dysmenorrhea. So let's watch out. Okay, let us look at how we can diagnose these two types of dysmenorrhea. Primary dysmenorrhea, as I already said, that there is no abnormalities with the pelvic organs. So what you can do is history. Take history. History is very, very important in the medical field. History tells you about the patient. History tells you what the patient is suffering from. So in primary dysmenorrhea, there is no problem with the pelvic organs. Let's take the history. However, in the secondary dysmenorrhea, we have already said there is an abnormality with the pelvic organs. So first take the history. What is wrong with the patient? After that, if you look at things and they're not adding up, normally request for an MRI, an ultrasound. These things will help you further. But in secondary dysmenorrhea, we go for further tests, not only history. So let us look at the treatment. We divide them into two: treatment at home and treatment when you go to the hospital. Treatment primary dysmenorrhea, we already said that there is no problem with the pelvic organs. So we only treat the pain. Person comes in with cramps, treat the cramps. However, in the secondary dysmenorrhea, there is a problem with the pelvic organs. So this is mainly or mostly treated in the hospital. And with secondary dysmenorrhea, we treat the pain and we also treat the cause of the problem. Remember, we said that there are problems with the pelvic organs. So you treat the problem and you also treat the pain. So we can start with treatment at home. Heat therapy. Heat therapy works for me. Heat therapy works for my sister. Heat therapy, I think, works for most women. Heat therapy, what I mean is, if you have a water bottle, we normally put like hot water into the bottle and put it on your lower tummy, where the cramps are. Normally, it's the lower abdomen or lower tummy. Put it there, and you keep quiet. I don't know the mechanism. I'm sorry, but the pain will go. The pain will go. Some people drink hot water. I used to take hot water too, and it also used to work for me. And it used to work for me. So heat therapy works. But be careful not to put the water bottle directly onto your belly. It normally will burn it. I've seen some people get like marks on their lower bellies. So at least have like a cloth on, or wrap it in a small cloth, and then you put it onto the, like, direct heat is also not good for your skin and your body. Let's talk about the different positions too. Different positions help out when you're having cramps. I used to lie, okay, I used to lie flat on the floor. Like on my belly, I used to just, like, we have tiles at home. So you expose your belly and put it on the cold floor. It works. It works. And then another thing, coiling yourself up. I mean, like, coiling. I will show you some positions. Coiling yourself up in like a small ball. It works too. It works too. Then when you're going to sleep, pushing your legs up. I'm going to show you the different positions. It works too. So find the position that works for you. I know we all have different weird positions. Your husbands, your boyfriends know these positions that you go in, and then they know, like, oh, it's the time of the month. So the different positions help us a lot, ladies. They help us a lot. They relieve pain. So different positions help you. If you're in that position and it helps you, stick in that position. Don't change. So you expose the lower tummy, and then you just lie. Like 30 minutes, all the pain will have already gone. Then this position also helps a lot. It relieves pain. Another thing you can do at home is exercises. Okay, I don't mean these vigorous exercises, punching someone, running. I mean, like, these simple things, like doing yoga, simple stretches. By the way, I have started stretching and it's good. It feels good. Yoga is also nice. Like, your body just keep, like, you produce these endorphins that feel good chemicals in your body, and the more you exercise, the more your body feels good and the more the pain reduces. So I would recommend, if you have cramps, do some little exercises. Start small. There are those tutorials on YouTube you can use. So start small and they'll help you out. So if all the above have not worked for you, I mean the exercises, the heat therapy, and the rest, then we can go the medical way. The medical way, we normally recommend the NSAIDs. the non-steroid anti-inflammatory drugs. These drugs normally reduce the chemical prostaglandin, which causes the contraction of the uterus. So therefore, we recommend them highly. However, we only recommend the first line. Note that not everyone can take NSAIDs. So if you have kidney disease, stomach ulcers, bleeding disorders, asthma, or you even have allergy to aspirin, please consult your doctor before taking them. NSAIDs include ibuprofen, which everyone can buy over the counter. However, I advise people to normally take ibuprofen and paracetamol together to get a grip or control over the pain. It works so effectively. I have used it. The trick with NSAID, it is not how many you're taking, how many times you're taking it. So the trick with NSAIDs is how you're taking them. For me, when I see the signs of periods coming, lower back pain, lower abdominal pain, what I do is I start my NSAIDs. I start my ibuprofen and paracetamol 3 times a day. This is the only way you're going to get control over that pain. You start before the periods come. If you start seeing the signs coming, you start your car drug, and then you take it for the next 2 to 3 days when you start your periods. I have seen people where these drugs, the ibuprofen and paracetamol, have not worked for them, and we had to climb the ladder to stronger opioids. And the stronger opioids I'm talking about are the pethidine. So it depends. Sometimes they may not work for you. Sometimes they can work for you. So if they're not working for you, visit the hospital immediately. Oral contraceptive pills, these ones are normally good for women who have heavy periods but also are not interested in having children at the moment. So with oral contraceptive pills, they're going to stop ovulation. And when ovulation is stopped, automatically stimulation of the prostaglandin is also going to be stopped. So therefore, no pain. So oral contraceptives, no ovulation, no prostaglandins, therefore no pain. However, you should be careful when you're using oral contraceptive pills in younger ladies because it will bring about infertility. So when you're using this, put that in mind. However, it is also a good medical treatment for people who are suffering from dysmenorrhea. Thank you for watching. If you found this video helpful, do not forget to share it. Let's talk more in the comment section. Do not forget to like, share, and to subscribe. See you in my next. Have a good one.